There is promising new data about coronavirus precautions tonight, and to discuss it with us is Dr. Daniel Koritzkis, Chief of the Division of Infectious Diseases at Brigham and Women's Hospital. Good to see you.
Good to see you again, Emily.
All right, so this study published today by researchers at your hospital, what it looked at the chances of patients or visitors who were actually infected at the hospital. These results, showed 2 people out of 9,000 likely got the virus at the hospital, one of them visiting before these restrictions went into place. So tell us about the precautions that were taken in March and what's being done now.
Well, this was a study that was led by Chanu Rhee, one of our hospital epidemiologists and a member of our division. And what was being done in March was really very little and focused mostly on identifying people who had symptoms of COVID. And then beginning towards the end of April, we insisted that all people coming into the hospital as visitors and as patients needed to wear a mask. And at the beginning of April had insisted that the entire staff had to be wearing masks. And I think it's really a testament to what an extraordinary job our infection control professionals have done and how committed the entire hospital staff has been to ensuring the safety of all of the patients and all of the workers. And it actually has results.
And it speaks, do you think, to the value of masking?
I think it really does. That's a great point, Emily, because I think it means we can translate these findings to the general community, that if we're all as careful and as cautious as the healthcare community has been in protecting ourselves and our patients, that we can also protect each other in society at large.
Right, exactly. Okay, so let's talk about this other project out of Brigham and Women's, finding that young adults who've been hospitalized with COVID-19, 1 in 5 of them required treatment in the ICU. We've mostly seen young people, handle COVID without a lot of complications. Was there a theme as to why 20% of these young people ended up in the ICU?
Yeah, there definitely was. So first of all, you have to appreciate that only a very small percentage of the young people who acquired COVID ended up in the hospital. And of those who ended up in the hospital, they tended to have the same kinds of comorbidities that we see in older patients who get into trouble. They are people who had hypertension, diabetes, obesity, and then 20% of those individuals ended up needing intensive care. But on an absolute scale, it's a much smaller fraction of that population, the young people, compared to, say, 70-year-olds, where 70% of them ended up requiring significant intensive care.
Right. The perspective always matters. Okay, Dr. Koritzkis, thank you for your time every Wednesday. We really appreciate it.
Sure thing. Always a pleasure.